building a better Bay Area. Moving forward, finding solutions. This is ABC 7 News.
Good afternoon, and thank you for joining us. I'm Amma Dates. You're watching Getting Answers live on ABC 7, Hulu Live, and wherever you stream. We're asking experts your questions every day at 3 to get answers for you in real time. Today, we're looking ahead to the new year and talking resolutions. If yours is to get fit, you might want to rethink your weight loss plan. A San Jose State professor will join us to explain why. Then we want to leave stress behind in 2021, right? Scientists from UCSF will join us at 3:20 to talk about managing stress during the pandemic. But first, there's always a lot to discuss with the COVID-19 pandemic. Today, the alarming rise in pediatric cases across the country continues to raise concerns. Experts warn Bay Area hospitals are likely to see an influx of young patients in the coming weeks. So joining us to talk about that and all the latest COVID news is Dr. Roshni Matthew, a pediatric infectious disease physician at Stanford Children's Health. Dr. Matthew, thank you for being here.
Thank you for having me.
All right, so let's talk about some of the numbers first. California's health department reports nearly 15,000 children, 17 and younger, tested positive the week before Christmas. Are we expecting those numbers to likely climb in the next few weeks?
Yeah, unfortunately, I think so. So the trend has been of positivity rates have been just increasing in all Bay Area counties, but also nationally everywhere. So I do anticipate that we will continue to see a trend that's going upward.
What about with hospitalizations?
So hospitalizations have always been a percentage of the total numbers. And so we can just anticipate that as the total numbers go up, we will see a rise in hospitalizations as well.
Are the symptoms as bad for the children who are getting it?
So not that we can see yet. For all variants, essentially, children have had milder symptoms. Of course, there will be a proportion of children who will have severe illness, and as the numbers go up, we will end up seeing more severely ill children. But overall, the symptoms have been very similar. Respiratory symptoms like runny nose, cold symptoms, fever. So those have not changed. And we are seeing severe illness in children with pre-existing conditions such as obesity, or children who have other medical conditions like neurological problems, cardiac or lung disease as baseline. So those trends seem to be similar to what we've seen in the prior surges.
What should parents be looking for? I know if my child got COVID, I would be hyper-focused on every symptom. When do we know it's time to take our child to the hospital?
So most often, children, especially who are otherwise well, will have mild symptoms. And so the parents would just watch for like any other respiratory illness, including like the flu, for example. Most often, children do just fine at home with good hydration, taking care of fever, so using Tylenol or ibuprofen or one of those anti-pyretic medications to help with the fever. So those measures should help most children. But if they start to notice more increasing respiratory symptoms like breathing difficulty, rising fevers, things like that, those would be times that you would take them to see a doctor or go to the hospital.
Yeah, definitely be in contact with your pediatrician. Do we know if it's Omicron or Delta that's infecting these children mostly?
Yeah, so that information is just coming in. So all those, the sequencing to figure out if it is Omicron takes some time. But what we know is that Omicron is rapidly replacing Delta. So overall, nationally, we know close to 60% are Omicron now. And closer here to home, we are seeing that the numbers may be higher. So essentially, and it may not really matter at the end of the day, because the symptoms and the reasons you would go to the hospital are very similar.
Yeah, and once your kid gets sick, you don't really care what it is. You just want them to get better.
Right.
There are concerns. Should we be sending kids back to school right away? Winter break is coming to a close. Some places are saying, hey, let's do virtual the first 2 weeks before we send them back. What are your thoughts?
I've always thought that children should be in school. And I do think that now, especially with the vaccinations that are available for the 5 to essentially K to 12, I do think that we have another layer of protection for the children. My only thought is that if your child is eligible and has not been vaccinated, to go ahead and get vaccinated. I do think that's cool. What we've known for the past 2 years now is that children can go to school and be safe. And so I would support that going back to school is a good idea.
Yeah, you said 2 years. It's just mind-blowing at this point. Do you see an end to this, or we just have to adapt?
Well, I don't have a crystal ball, but what my feeling is that Omicron hopefully is going to be overall milder. So although the numbers are going up, hopefully we'll see that the severity is lower. And we are going to have to live with COVID, and hopefully, if not Omicron, the next variant will be like the common cold. So I don't think there is an end necessarily, as much as we have means to protect ourselves, and it will be a milder illness overall.
That would be wonderful. Now, you talked about vaccines. There's a push to get kids vaccinated, but the shot isn't yet authorized for kids who are under 5. How do we protect those kiddos? Because a lot of them are going to preschool and other things like that.
Right. I just think that all kids that are eligible should just get vaccinated. And for the children who cannot be vaccinated, everyone around them should be vaccinated and boosted at this point. So I think that's the way to, that's at least a major layer of protection for those children who cannot yet be vaccinated. And the rest of the things are things we have done for the past almost 2 years, that even children know now what to do. Essentially wearing a mask, especially when you're indoors, avoiding crowded spaces, maintaining a physical distance around people who do not belong to your household or belong to your safe bubble, doing the usual things, washing hands and all of that. So those still remain good protective measures in addition to vaccination.
And you mentioned boosters. Reports out today say federal health officials should expand eligibility for Pfizer booster shots to children ages 12 to 15 in the coming days, as long as they're fully vaccinated. Can you tell us about this?
Yeah, all I know is from the media and outlets as well. So we just have to wait on FDA and CDC for further information. But essentially, the 12 to 15-year-olds got their emergency use authorization of Pfizer in May of 2021. So that's a little over 6 months ago. And so essentially, they are in that same time frame of waning immunity. So it makes sense that they would be next in line to get the booster. So we'll just have to wait and see what happens.
We have a viewer question for you now, raised about masking in schools. Doctors have been telling adults to switch to the N95. Is that going to be recommended for school-age children as well?
In my mind, masking is just one of the layers of protection. So there are so many. So vaccination is still our most dependable layer of protection. Masking, it's dependent on several things. So ventilation and all of that plays into effect. And ultimately, it's the fitting of the mask. So if you have a good mask that fits you well, I just think that is good enough. So for children, for example, wearing an N95 for hours on end may not be practical. So I would use what is workable and what they will keep on their face.
Yeah, that's what I was going to say, because kids are messing around, whatever they're going to keep on, and give them some protection. And speaking of masking, all Bay Area counties are tightening up their restrictions, meaning masks are now required once again in all indoor settings. You believe this was necessary in the age of Omicron?
Yes. I do. I think Omicron, the problem with Omicron is that it is highly transmissible. At least that is the preliminary information we have. And so masking is just one step every step that we do is helpful. But in certain areas, we cannot avoid we cannot take care of certain things, like making sure the other person is vaccinated or making sure we can maintain physical distancing. So in those instances, masking is another way to protect ourselves.
All right, we have 30 seconds. Any advice for people with New Year's Eve right around the corner?
Yeah, I think now is the time to just take extra caution. If you have plans for crowded events, especially indoors, it would not be such a good idea, actually. But small gatherings with people you know are vaccinated and are not sick, for example, is probably going to be fine. But I would just make sure that that we take all care, because the cases are continuing to rise.
All right. Well, Dr. Roshni Matthew, pediatric infectious diseases physician at Stanford Children's Health, we thank you so much for your insight today, and we wish you the best in the new year. We're all hoping for some improvement. We need it.
Thank you very much. Have a happy new year.
All right. Thank you. You take care. Well, up next, losing weight is a popular New Year's resolution, but it might be time to rethink that. We're going to tell you why. Keep it here. We have more Getting Answers after this quick break. New Year's Eve is tomorrow, so we have to ask, have you made your resolution yet? I don't bother making one. Anyway, we polled the ABC7 newsroom, though, to see what some of our coworkers are going to be up to in 2022. The #1 most popular answer was, of course, to lose weight or start a workout plan. But before you go all in, you might want to rethink that. Here to explain why is Dr. Natalie Boero from San Jose State University. Thank you so much for joining us.
Thank you, Emma, for having me.
Okay, I could go 5 hours on this with you, so let's jump right in.
You and me both.
Yeah. I'm going to be very probably passionate. Okay, so weight loss for a New Year's resolution. You think this can actually harm health. Can you explain why?
Absolutely, because I think that, first of all, how many of us haven't resolved to lose weight in our lifetimes? It's the resolution that keeps on giving. And somehow we never really get the fact that if all the things we were doing worked, we would never have to make this resolution again, right?
Yep.
And I think that for me, when we resolve as individuals to try and lose weight, it comes from a place of shame and stigma. And really often it doesn't come from a place of concern about health. Right? Now, what you said at the very beginning was that your colleagues were interested in both losing weight and starting a workout routine. And I think part of the problem is that we see those two things as both related, right? Or as inherently related. We see weight and health as inherently related. And to me, resolving, although I don't make resolutions in the traditional sense either, but looking to be more physically active, wanting to be more healthy in a variety of ways that are within my control is not a bad goal. It's not a bad thing. It's not about attention, right? But when we resolve to lose weight, we set ourselves up to fail. I mean, I always say that, if the weight loss industry worked, whatever we call it, weight loss, wellness, eating plans, lifestyle changes, it would be out of business. right?
And they want our money. They're banking on us failing because they know it's not going to work. And that's why it's what, multi-billion-dollar industry?
Yeah, it's heading into the hundreds of billions of dollars. And what's interesting is that 95% of diets fail over the course of time. And most people gain those pounds back and then some, right? So we often hear these huge headlines about how Americans are among the fattest people in the world or the most overweight and obese people in the world, et cetera. Well, I don't think it is random that we're also the people in the world who are most likely to diet, right? That if every time we diet, 95% of the time, we're going to gain back weight, we're going to mess with our metabolism, we're going to do all kinds of things that aren't healthy, including lapsing into a lot of self-hatred when we fail and, messing ourselves up economically for sure, then it makes sense to me that Americans are some of the heaviest people in the world, because we're also the ones who are most likely to diet. And we're the country in which we spend the most on trying to lose weight, the most money, right?
And we're learning that weight cycling can be even more dangerous than having a so-called few extra pounds on you. And let's talk about the fact that weight does not equal health. You were quoted in an article where another doctor was saying how the doctor has someone in a normal BMI who has type 2 diabetes, but somebody far outside the normal BMI is perfectly healthy. All their markers are great. What somebody looks like on the outside does not translate to what their health is.
Right. And also, I'd just like to note that I don't think, we need to view health as a moral imperative. There are plenty of people with health problems who are, people with health problems are utterly deserving individuals as well. But if we're talking about health, no, you can't tell somebody's health status just by looking at them. You can't tell their health status by a number on a scale or a BMI number. And more importantly, if we know that we can't make people smaller over the long term, and, there are plenty of critics of the measure of BMI out there, then what can we do to make ourselves and our society healthier, right? And that's where the health at every size perspective comes in, right? How can we encourage a sense of health and healthful activity, but also broaden our definition of health so that it includes living in a society where we have access to healthcare, where we have economic security, where we are not seeing the intersection of weight stigma with things like racism and sexism and classism, right? That when we boil health down to this individual BMI number, an individual, diet plan or amount of workout, we kind of lose this idea that health is about a lot more than our individual behaviors. And yet still individual behaviors can matter, right? Tell my kids, I'm always bugging them to eat more vegetables. I'm always bugging them to get out and run around more. But that doesn't have to be tied to a weight. And I think we do ourselves and others a disservice when we do that. I mean, if we actually started exercise plans in January with the idea that we were going to do more physical activity to feel better, to improve our mental health, to maybe improve some kind of a, particular health issue we're dealing with, we'd probably last a lot longer doing it rather than joining the gym in January and being out by March because we didn't see the scale budge.
Right. And then blame ourselves. It's the only thing where when a diet doesn't work, we blame ourselves. It wasn't the diet's fault, but it's our fault. Again, I could go on with you for days, actually. We could go into the new year in 2023, but we are out of time. So thank you so much for joining us, Dr. Natalie Boero. We appreciate your time and Happy New Year.
Happy New Year.
All right, take care. All right, up next, we're going to talk about managing stress in the new year. Stay with us. Getting Answers is back after this quick break. Hard to believe, but we are now nearly 2 years into the pandemic, and besides our physical health, there is no doubt it's taken a toll on our mental health as well. Each development seems to bring new concerns, and that means more stress. So how can we manage it? Joining us to talk about that is Dr. Alyssa Eppel, a stress scientist and psychiatry professor at UCSF. Thank you so much for joining us.
Thank you, Alma.
So let's be honest, it seems like every day there's a new headline, a new worry with the pandemic. How do we even start to handle all this?
Like you said, we've learned that the future is uncertain, that there's always something that we can't predict or control. And that's actually information for us for going forward. We don't have an end date to the pandemic, but we know it's not going to be sudden. So asking when it's going to end is really creates more stress and anxiety, I think, but rather just embracing this kind of new reality we have of not knowing, a not knowing mind, embracing this idea that we don't know what the headlines are tomorrow, and we're just going to do our best together to cope with whatever the world has in store for us. So it's a time of really buckling down to what matters most to us and focusing on what we can control and what we can do today.
I think not being able to control something or see the outcome is really hard for a lot of people. I know it's definitely hard for myself. I mean, the topic of coping with stress is such a popular one that the CDC has a whole section dedicated to it on this website. I mean, what does that tell you about what people are really facing?
I think that we are experts at living in a pandemic now, and it is, as you said, it has a huge long shadow on our mental health. And so there are lots of lessons here and things we can do. I mean, number one, everyone is struggling. You are not alone. This is a particularly confusing day with the peak of Omicron and all the uncertainty. And so talking about mental health so that we don't stigmatize it further, and seeking help, seeking support with each other. You know, I think the holiday is a really important time to reach out to others, text or call, because a lot of people are alone, and it's a really hard time to be alone during the holidays.
Yeah, it really is. You know, I think a lot of people just try to mask the stress and the toll it's taking on them because you don't want to bring anyone else down. And that person seems fine. They're asking, hi, how you're doing? So I'm going to say, oh, great, and move on and pretend. I know there are a lot of days that I'm not okay, but you just sort of put on a happy face and make like everything's okay. Is there any way to tell that somebody maybe could use a little extra help, that they're really struggling with the stress?
That's a great question. I always laugh when someone asks how you are, right? Because it's such a qualified answer. Well, you know, midst of a pandemic, I still have this and that. Mm-hmm. And so focusing on what we do have and what's going well is helpful. But asking again, you know, I think like you said, the first answer is the kind of autopilot, socially socially expected answer, which is things are fine. But asking, you know, how are you really? Or what's been hard? Or is there anything I can help with? Those are the types of questions that usually do get honest answers and maybe even tears, because, you know, taking the time to really listen to someone is a gift, you know, rather than talking about the latest news, really just asking, what has it been like for you? Right. What's the hardest part? It's been a time when people have become more genuine and they're just, I think there is less small talk. It's that kind of common humanity of being in the same boat together. What
about kids? What should parents be looking for in kids?
I think that our biggest worry is kids and youth right now and their mental health. They have taken the hardest hit. And for kids, you know, I think we need to have a resilient new mindset. And what is resilience? Flexibility, having plan A, having plan B, also plan C, and going with the flow. Because it's so easy for their expectations to get set on something like a birthday party and to be so disappointed when things are being canceled, etc. So really, the lesson is the world is full of surprises. We don't control them, but we get to choose how we respond when things shut down, when things don't go the way we want them to. What do we do about that? Anger is not a helpful response. Of course, it's natural to feel angry about this, but focusing on what we can control and what we can do. So for kids, it's important for them to talk about their frustrations and disappointments and fears. So asking and listening and using play as a way to have them express their fears.
Yeah,
and
definitely.
Really finding ways to be in nature. Nature is so important for kids.
Kids and adults.
Yes, absolutely.
All great advice. Thank you so much, Dr. Alyssa Epple, for joining us today to give us some tips and some insight on the stress that we are all just trying to manage and trying to move forward with. Happy New Year, and thank you for your time.
You.
All right, stay with us. We'll be right back. And we thank you so much for joining us on this interactive show, Getting Answers. We will be here every weekday at 3, except for tomorrow, it's New Year's Eve, on air and on live stream, answering your questions. World News Tonight is coming up next, and then stay with us for ABC 7 News at 4 o'clock. We will see you then.